fatty liver is the new metro badge antara?
We stop liquor, we are drinking beer. They consider that beer as not alcohol.
Can hit a rewind if we detect and catch it early?
Alcohol has certain benefits.
So welcome to the program, Dr. Santhosh sir. It was a pleasure to have you.
Thank you, Dr. Lakshmi.
So I think these days liver health is on the spotlight. So how important do you think liver is for our health?
First of all, the liver is the most important organ in the body, maybe more important than the brain, because it's like a engine of the body. Lot of chemical processes will be happening. So whatever we eat, take orally, will be processed in the liver, and the waste products will be eliminated. So it plays a very vital role in the health of a person, and it decides generally how the person is going to be health-wise.
So do you think that our liver is the real victim for our metro lifestyle these days because of the fast food we eat or late nights or the stress we take?
Big hit. Yeah, you are right. Staying in metros, people will be exposed to stressful lives, busy schedules, excessive calorie intake, increased number of parties, reduced hours for exercise, and these play a vital role in damaging the liver. So all things which matters as far as the liver health is concerned are being affected by urban style of living in metros. It will affect each age group differently, but every age group will be affected because of this urbanized lifestyle.
So you mean to say that fatty liver is the new metro badge antara?
Definitely. Fatty liver will affect in two ways. Fatty liver is the first stage of the liver disease in the development of chronic liver problem. Having just grade 1 fatty liver is not to be worried, but it gives a warning that there may be additional problems coming in the way in future, like early development of diabetes, worsening diabetes. And if somebody who is having fatty liver because of the obesity, that makes them more prone for developing liver problems if they take excessive alcohol, if they develop diabetes, or if they are prescribed certain medications if they are above the age of 50 years.
But is it also true that fatty liver can hit a rewind if we detect and catch it early?
That's the good news. So fatty liver is in equilibrium. So the moment body's calories intake will go up and they put on weight, the excess fat will be deposited like any other part in the body. Liver also gets its own share. But this is a damaging type of fat which is in the liver, and then it is in equilibrium with your exercise. The best treatment for the fatty liver is removing the fat by burning it out. That is doing regular exercises.
That makes sense. And I don't think if we have to talk about liver health, I don't think it's never incomplete without talking about alcohol and its toxic effects on the liver. So, Asal, how do you think alcohol is directly hitting the liver?
Liver needs some time for detoxification to get the excessive metabolites generated by the alcohol to be out of the system. And also, it uses a lot of micronutrients, vitamins to process the alcohol metabolism. So if they are not giving enough time for the liver to regenerate and if they drink daily, it is going to be a drug-induced liver problem. So this is going to increase liver disease in people who otherwise would not have developed a liver problem.
But is there anything such as safe limit or healthy limit for alcohol?
Alcohol has certain benefits according to cardiologists when it is taken very occasionally. Everybody talks about red wine, white wine benefits of the cardiology.
I think most of them would be interested to know that.
But this one, taking alcohol daily is injurious to health. Taking alcohol frequently is injurious to health. Taking alcohol at one go in a binge manner, drinking a lot of alcohol, not only damages the liver and also damages the pancreas. Pancreatitis is a life-threatening illness when it is very severe, and this is usually seen in people who binge drink. And regular alcohol intake will lead to dependence, and they start drinking in the mornings and afternoons, then they become dependent neurologically on the alcohol. These are the group who develop double hit. That is, they will develop slowly damaging neurological system, that is shrinking of the brain, early aging, memory problems, neuropathy with a lot of pains, and also slowly damages the liver, make them prone for the cirrhosis of the liver.
And also, most of us think that, they drink only on the weekends, they think that the liver is okay. Is that true?
If they are very healthy and if they drink in moderation, very small amount of alcohol while eating normally, that probably will not cause much problem. But amount matters. If any male drinking more than 7 to 12 units in a week and females more than 7 units in a week are likely to develop alcoholic liver disease. But this again depends on what is the body's nature. So if they are obese and they already have a fatty liver, any amount of alcohol can damage them if they drink very regularly.
So I'm sure, there are many myths surrounding liver and liver health. So what are some common myths that you would like to clear it for all of us?
Commonest myth is when we see people who started developing alcoholic liver disease or who already developed alcoholic liver disease and we ask them to stop drinking, they come back after 3 months and say that we are not drinking. When you inquire again, they say that you stopped liquor, we are drinking beer. They consider that beer as not alcohol. Both are alcohol. They are basically alcoholic drinks with a different amount of alcohol in it. So drinking beer is not equal to not drinking. So it is also alcohol. So one has to stop all types of alcohol once you are told to stop the alcohol.
And also, one of the common thing we see is people who don't drink alcohol, people who have a healthy lifestyle also get liver diseases. Is that true?
That's also true because there is something called as lean NASH. Lean NASH means people who are not obese may have a visceral fat. Those people who have a lot of fat inside the abdomen but not outside will also have increased fat in the liver. This is a type of fatty liver which is commonly seen in Southeast Asia and also in India. These people also develop damage similar to those who damage their liver by drinking regularly or those who have diabetes and develop fatty liver.
One important aspect is preventive medicine. So when do you think one should go for all these checkups, especially for the liver? Is there any certain age limit or risk factors that we should consider?
Obese children should start to be screened from the age of the 20 years. Young adults should have at least one health check every 5 years. People above the age of 40 years should ideally have yearly health check. Health check not necessarily will pick up the early liver disease because liver functions and liver ultrasound can be completely normal if we do random checks. But a serial health checks would find a trend in identifying worsening liver. And we can also do specialized investigation in selected groups who noted to have liver abnormality.
So what are some healthy tips that you would advise for all our viewers out there to keep the liver healthy?
So as I mentioned, liver plays very vital importance in the health of the person. If the liver is not good, all the systems will get affected directly or indirectly. So taking a healthy diet, eating fresh vegetables, consuming balanced diet and drinking minimally or avoiding alcohol and cutting down on excess calories by reducing the carbohydrate rich food and outside food frequently with regular exercise will keep your liver in healthy state. And sometimes if you need to know further information, we do special test called FibroScan, which will tell us how much fat is in your liver. And when you come back again after modifying your lifestyle, we can reassess and show that the liver fat is melting away on the scans.
So on a casual note, doctor, do you see people coming up to you during the parties or get-togethers and ask you if the one drink is okay, or this food is okay for the liver?
It is the common question we face whenever we meet people, and also during all our symposiums designed to address the liver problems. So we normally tell them that basic health monitoring is important. Knowing their liver status is also important. Some people may have undiagnosed hepatitis B, hepatitis C. It is important to check those viruses and also get vaccinated against the hepatitis B, which will protect them for life and their families. And then alcohol effect on the liver can also be managed by keeping it in moderation, keeping for occasional drinks rather than regular party. So weekend parties are probably okay for urban people, but not alternate day parties.
Having studied liver so closely, what is that one secret you would like to tell us that we general public do not know?
So your liver has lot of spare capacity, and we almost have 50% extra liver to take care of us. Unlike other organs which will make you symptomatic, liver will give you extra 10 years of that time
That's a
before
big
it
time.
fails.
Yeah.
So act early, know your status, and modify your lifestyle. Take precautions, take vaccination when it is needed.
So also that doesn't mean we have to overburden the liver just because we've got 10 years of time.
That's right. That's right. Because this 10-year period gives you enough opportunity to make things reversible and change your lifestyle, so that this also prevents future diabetes, hypertension, and also liver cancers. So people who develop chronic liver cirrhosis not only will have poor outcome, they die early, they may need transplant. There is no other treatment other than the transplant for them. So save your own liver, take care of it, and avoid the liver cirrhosis.
And finally, what message you would like to tell our viewers out there as far as liver and its health is concerned?
Include liver-related blood tests whenever you visit a doctor, and also get a ultrasound of abdomen. If you never had a viral check, you check your blood for hepatitis B, hepatitis C virus, and also measure your fasting glucose when you first time you go to see the doctors. And then subsequently we can plan regular health checks based on your liver status, and we will give a advice on how to improve your fatty liver if you have it. On the other hand, don't get worried by 2 points abnormality on your liver test. This is a common thing we see. If your blood tests are 2 points above, 2 points below your normal limits, that is absolutely normal. You don't have to get a stress about that one. Having said that, keep your liver in check always.
So thank you, Dr. Santhosh, sir. It was wonderful interacting with you.
Thank you, Dr. Lakshmi.